Good day everyone! Today, we are going to perform the proper procedure of two of the first aid method such as CPR and choking. I am Angela Hilasanca Rocha, together with Dara Kate Delphine, Samantha Ashley Hilasanca, and Clark Hirasol. Choking happens when a foreign object, usually food, stalks in the throat or windpipe, because choking blocks the oxygen supply to the brain. It needs an immediate first aid response to the victim. Commonly, the sign for choking is showing the hand clutch to the throat. If, however, the victim does not give the signal, look for these indications: helplessness and inability to talk, struggling to breathe and breathing nosily, squeaky sound when trying to breathe, weak or forceful coughing, the skin may turn blue or pale, lips and nails turning blue, loss of consciousness, and advise the victim to cough continuously, or if the victim cannot talk, ask him to cry or laugh forcefully. It is recommended to administer the 5-5 approach.
Five back blows. Stand to the side just behind the victim. Bend the victim over the waist to allow the upper body to be in parallel to the ground. Administer 5 separate back blows between the person's shoulder blades using the heel of your hand. 5 and 5 approach. 5 abdominal thrust or Heimlich maneuver. Stand behind the victim, placing your one foot in front of the other for balance. Wrap around your arms around the victim's waist and instruct the person a frontward position. If the victim is a child, kneel behind the child. Place your fist above the victim's navel and press hard into the abdomen with a quick upward thrust if you are lifting a person. Administer between 6 to 10 abdominal thrusts until the blockage is dislodged.
CPR is a life-saving method during emergencies, specifically applies to the person who is having a heart attack or near drowning. If in case the person stops breathing or no pulse or heartbeat, it helps to keep oxygenated blood flow around the brain and other vital organs. When the heart stops, oxygenated blood cannot circulate and may cause brain damage, and the victim can die within 8 to 10 minutes.
Before starting the CPR, please check first the following: safety of the area for the victim, check if the victim is conscious or unconscious, check the vital signs, and call the local emergency number immediately. Compression. It aims to allow the blood to circulate and supply the oxygenated blood to the brain. Place the person on his back on a firm and flat surface. Put yourself in a kneeling position next to the victim's neck and shoulder. Place the heel of your prominent hand over the center of the victim's chest. Airway. Allows the air to enter. If you are a trained person to perform the CPR, administer 30 compressions. To open the airway, put your palm on the person's forehead and gently tilt the head back. On the other hand, gently lift the chin forward to open the airway. Breathing. Rescue breathing can be done by mouth to mouth or mouth to nose. Along with the airway, pinch the nostrils to close. Provide the mouth to mouth. Seal the casualty's mouth with your mouth. Prepare to give a rescue breath. Give the first rescue breath. And watch the casualty chest rises. If it rises, prepare to give the second breath. If the chest doesn't rise, repeat the head tilt, chin lift maneuver, and then give the second breath.
First aid can save lives. When it comes to more serious injuries, first aid provides an essential role in keeping a casualty from getting worse and helps to stabilize their condition before professional help can arrive. It is an important tool in quickly responding to accidents to ensure that inquiries can be efficiently and promptly dealt with before a trained medical professional arrives to administer more specialized treatment. Whether it's a minor injury or something more serious like fracture, preventing further complication is paramount. Ensuring there are trained first aiders will help the surrounding to be a safer environment for everyone.